Cancer. What are your feelings when this word is mentioned? Is it fear, pain, suffering, or maybe death, or even all the above? According to statistics, among all the forms of cancer, the number one cancer killer among women in Malaysia and the world is breast cancer. Despite government's effort to create more awareness and early detection, the number of cases every year are still rising. Therefore, it is important for all of us to equip ourselves with the right knowledge and basic understanding of this form of cancer in order to benefit ourselves and others. Today, DAO Talk is grateful to be able to invite a specialist with 20-year experience in breast and endocrine surgery to share with us about this topic. Please welcome Dr. Harjit Kaur.
Good afternoon, everyone. Breast cancer. Now, it is the number one cancer killer of women in Malaysia as well as worldwide. Women fear they do not come forward to get themselves checked, to get themselves treated. And in Malaysia, you'll be surprised that almost 40 to 45% of our women are still presenting very, very late. They come at the stage 3 and stage 4 periods of the disease, which is very, very unfortunate. Now, you may wonder why. Why is this happening? In our Asian population mainly, there is a lot of deep-rooted beliefs which are ingrained in us from young, especially beliefs towards the traditional treatment of things, the bomos, the sensei. A lot of people rather go and see them first when they have a problem rather than come and see the conventional doctors. There's this fear that if I go and see a doctor, I'll lose my breast. So they try the alternative treatments first. And these usually end up making the patient's disease progress. They become worsened. Their stage from an early stage gets progressed to a late stage. So by the time they come to the doctors, it is often too late. This happens so often. There seems to be a stigma about being diagnosed with breast cancer. So they will listen to their grandmothers, listen to the mothers who will tell them, no, we are not going to the hospital. I'll take you to my traditional healer. Oh, don't mention anything to your neighbor. You don't want the neighbor to know that you have breast cancer. What will my friends say? These are all the things that patients always tell me when they come. You know, I was just too embarrassed to tell people that I had breast cancers until I had no choice but to come and seek for treatment. But sadly, by then, often it is late. Too late, in fact, sometimes. Now, there are many, many risk factors that one needs to know about. Now, one of the most common risk factors, of course, if you have a strong family history of breast cancer, or if you have the BRCA gene running in your family, then yes, you run a very high risk of developing breast cancer. The other risk factors which are very common is stress. And stress is known to cause a lot of problems in people. It reduces your immunity if you're not able to cope well, and it triggers you to develop all kinds of diseases, including cancers. So we need to have support. We need to understand how to manage stress. And if we can't, if we're having difficulty to cope, we need to get help. Now, the other factors are obesity, meaning being overweight. And if you have a bad habit of smoking, you are going to increase your risk of developing cancers much, much more. Now, there are lots of other things, environmental factors. We can't put a finger on it, but our environment definitely plays a very important role as well. Now, most of us these days are surrounded by technology. Our handphones, our computers, we are surrounded by this ball of radioactive waves to a certain extent. All these do also play a factor, although we do not have definite statistics or definite pointers to say that it is true, but it definitely plays a role. And if your genetics more predisposed to having some genetic mutation or change, that is why you get cancers. And this is why it's happening to many, many people. Now, when we talk about hormones, hormone replacement therapy, oral contraceptives, these are not 100% causes of developing breast cancer. But in some people, hormones may trigger changes in you if you are prone to it. So it is a very controversial topic. there's pros and cons about the usage of hormones. So as far as possible, if you can avoid it, we would advise you to avoid it. But it doesn't mean that you can't have it as long as you take the necessary precautions, do your regular checkups. These are the important things that one has to do. Now, what are the common misconceptions people have about cancers? Now, they tend to think that only women get breast cancer. And when you ask the young women, many of them will have this attitude that says, oh, I don't have to worry about it yet. I'll worry about my breast check when I'm older, once I'm menopause. Because of this thing and this understanding, of this wrongful understanding that cancers only happen to older women. And I don't, have a family history. So why do I need to worry? I don't have anyone in my family having breast cancer, so the likelihood of me getting breast cancer is not there. So these are the common misconceptions that people tend to have. A lot of people are fearful of mammograms. It's going to compress my breast. It is painful and it's going to give me cancer because the radiation from the mammogram machine is going to give me cancer. Therefore, I do not want to do a mammogram. This is the wrong concept and the wrong perception that many people tend to have. And these are the things that I'm going to try to clear it for you today. And the fact that there is no such thing as no cure for breast cancer. Breast cancer is curable as long as you pick it up early and you have the right understanding about the disease. So the facts are breast cancer can happen to men as well. Although the number or the statistics is much less, 1% of men can get breast cancer. More so if they have a family history. And these days, younger and younger women are getting breast cancer. Now, the average age of women that we are seeing in our clinic, in our practice these days, are in their mid-30s to 40s. Most of my patients are in that age group rather than the elderly. Although the elderly do get breast cancer, but the spectrum has moved down. The whole spectrum has moved down towards the younger groups of patients. My youngest patient was 20 years old when she developed breast cancer. So you need to be aware. You cannot say that I will not worry about it. And majority of these women these days who get breast cancer do not have a family history of breast cancer. So if you ask their history, they say, no one has ever had breast cancer in my family. I'm the first, which is very shocking for them. So many can't accept that because they said, no, it's not possible. How did it happen to me? Now, the other thing I want to clarify is mammograms. There's so much of fear about mammograms. Now, mammograms are not painful. Yes, I will admit it's a very short, quick discomfort when the plates come down on your breast, when they compress the breast a little bit. But you must understand that the machines these days are so much better. The new technology, the new advanced systems that we have these days make mammogram not so difficult and it's not painful. And the dosage of the radiation that emits from these machines are very, very low. It is not in any way going to create or give you breast cancer or create a cancer in you. The radiation that you get from flying in an aeroplane from Kuala Lumpur to London and back is sometimes even more than your mammogram radiation. So this is the real thing you have to understand. So it is not going to give you cancer. In fact, it may save your life by picking out a breast cancer in you at its very early stage. And that's the whole idea of doing mammograms, ultrasounds, which is part of your annual yearly screening, which every woman must do. So as I mentioned, you can't avoid breast cancer. So your only armamentarium that you have, what you can do is to be breast aware. You want to have early detection so that if you have early detection, you can diagnose the disease early, you can be treated early, and then perhaps we can get a potential cure. Cancers can present in many, many ways. So the most common, of course, is screening. If you were to practice screening, you're going to be caught at a very, very early stage of the disease, whether a very small, tiny lump or microcalcifications, which I will explain in a minute. Breast lumps. By the time you feel a lump in your breast, it is usually about 1 centimeter in size to be able to be sensitive enough for your fingers to pick up. When a lump is at about 1 centimeter, it probably has been sitting in you for the last 6 months to a year. So it's not really early anymore. So it may be still small, but it is not at the earliest possible that you could hopefully have caught it. By the time you have things like nipple discharge, skin changes, nipple retraction, or even, lymph nodes in the armpit, it is already considered late. You're already going on towards the stage 2, the stage 3 disease, which is not extremely early breast cancer. So the early signs of cancer, one should know when you do a mammogram. So this is what you're going to see, small little clusters of white specks, which are called microcalcifications. Now, microcalcifications are the early warning signs of cancer. So here, slightly enlarged, you can see it clearly. So things like this, if you see the nipple getting retracted in, this is what happens. So when a tumor is sitting inside, it's like a scar, it's like a crab. That's why cancers are called cancers, because it's the crab. It's got these tentacles that comes out of it, and it catches onto your tissue. So it catches onto the nipple and pulls the nipple in. So if you notice that your nipple is suddenly going inwards when it was always outside, that is a very, very dangerous sign. You don't sit on it. You go meet with your doctor immediately to get a check done, to find out what's going on. So please never self-medicate, never sit on it, never pretend that you don't notice it. Go see a doctor immediately. So when we talk about breast cancer management, management is a combination of many things. You have surgery, you have chemotherapy, you have radiation therapy, you have hormonal therapy, you have targeted therapies. There are many combination of things. Whether you need all of it or just one of it or a combination of 2 or 3 of it will depend very much on the staging at which you are diagnosed, the type of cancer you're having, the nature of the treatment that you chose, the modality of treatment that you chose, whether it's a radical form of surgery or a minimally invasive surgery. But the whole idea is we are moving away from radical surgeries. When we talk about radical surgery, we're talking about, ablative surgeries where you remove the breast, you remove all the lymph nodes. These are things that we're trying to get away from these days. We are moving towards more and more minimally invasive surgeries, meaning less is more. So the only way to do less is for you to be diagnosed early. So we talk about breast conserving procedures. That means you don't need to lose your breast. You can keep your breast. We talk about sentinel node biopsies. Traditionally, when you do breast cancer surgeries, we tend to remove about 2/3 of the lymph nodes in the armpit. And that's called an axillary clearance. That used to be standard at once upon a time. But now the gold standard is a sentinel node biopsy, because we are going to check on the first lymph node first. If it is not involved with cancer, you do not require to remove all your lymph nodes in the armpit, which is what traditionally is done. So your morbidity, your recovery is better. You have less and less potential side effects which are associated with the more radical surgeries. Okay? And then I'll talk about intraoperative radiation therapy, which is something new that we have these days. Again, a minimally invasive procedure where the radiation therapy is concerned. So breast conserving surgery, when we talk about breast conserving surgery, it means keeping the breast, not losing your breast. So you can only do that if the tumor is small, and if the tumor size compared to the woman's breast size is small, so that you can achieve good cosmetic outcome with the surgery. Now, if the tumor is large, when the women present late, the tumor is big, 3 centimeters and above. Now here, it is impossible to save the breast, because you cannot err on the side of cosmetic and leave cancer behind. So in those situations, these women have to lose the breast. So they either go for a mastectomy, which is a simple mastectomy, or what we call a modified radical mastectomy, where you remove the whole breast and you deal with the lymph nodes at the same time. Or these days, what we do, we give patients option of an immediate reconstruction. So it's a personal choice. So we tailor the procedure according to also what the patient wants. It's very important. So modified radical mastectomy, as I mentioned, is removal of the entire breast. So the problem with this is, if you are small-breasted, you may not have too much of difficulty, because, just with a prosthesis in your bra, when you wear your clothes, everything seems okay from the outside. You don't feel any different. But if a woman had a large breast and you remove one of her breast, it becomes a very big problem for her in terms of her balance, in terms of her cosmetic outcome post-procedure. So they also have a lot of psychological and emotional issues associated with them. Loss of self-esteem when they don't have. So you may have cured them of the breast cancer, but they are miserable. they feel miserable. They are depressed, they're not doing well because of the cosmetic outcome. So these are prophylactic mastectomies. So I'm sure many of you all have heard of the Angelina Jolie effect when it happened. So what did Angelina Jolie do? She removed her breasts before she developed breast cancer. So she removed the breast because she had the gene positive. It was running in her family. Her mother died of ovarian cancer. So she was fearful that she, at some point in her life, is going to get breast cancer or ovarian cancer. So she removed both her breasts before that happened. So similarly, in this woman, both her breasts have been removed and they've been replaced by implants. So these are called prophylactic mastectomies. So post-surgery treatments, very quickly, I'm not going to go into details because it's a whole new topic by itself, is the chemotherapy, the radiational therapy, hormonal therapy, and targeted therapy. So these are therapies that come after surgery if you need to have it. So this is what we do. Now, the thing I'd like to highlight is, of course, a story about a patient of mine before I go ahead. This was a lady who was 77 years old when she presented to me. Again, she had a tumor which she sat on for about a year. She went to all her traditional healers to try to manage it without telling anybody about it, until the tumor became bigger, until it became painful, it started bleeding, and that's when she came to see and seek help. That's when she came to seek help. So when she came to me, she was, literally in tears because she had seen someone else who told her, "Auntie, just go home. We can't do anything for you. You probably have about 3 months to 6 months to live. Be happy." And that devastated her. So that sort of was like a wake-up call to her, because she was otherwise fit and well. She was well for her age. So when I saw her, this is what the disease looked like. So it was already eaten away into her skin right down to the bone. But fortunately for her, when we did her CT scan, it was absolutely clear elsewhere. So she had a locally advanced tumor, a very slow-growing tumor that was eating away at her for the last 1 year. But it did not spread to any other parts of her body. Her lungs, her liver, her bone, everything was clear. And so I made a deal with her, actually. I told her, "Look, I will make an attempt. We will operate on you. We will clear you of the disease. But you got to promise me that you will listen to me and follow my management after this." And she said, "Yes, I will do it." Okay? And so we had a very radical surgery done. We removed all the tumor right down to the bone and did a little bit of a rotational flap. We closed up the wound, stitched her up. I mean, she did very well for her age. And she recovered from surgery. She went through the 6 cycles of chemotherapy as promised. She went through radiation treatment as promised. And today, 7 years later, she still comes to me regularly for her follow-up. And she's doing amazingly well. For someone who was given 3 months to live, she has survived 7 years now, and she has traveled all over the world since her diagnosis. She told me, my dream was to see the world, and she's done it. She's seen more countries than I have seen. So that's how much she has done since her diagnosis, and she's got her second life. So what I'm trying to say is, never give up. Never say never. A disease can be treated if you give it a chance. Of course, I'm not saying all disease can be treated if you come late. The idea is not to come late, but don't give up, because it is still possible to treat if your disease responds to treatment well. Now, radiation treatment, which is the traditional treatment that is done, is 5 weeks of radiation. Patient has to come every day for 5 weeks in a row so you get about 25 times to 30 times radiation. That's how it's given traditionally. Now, all that can be switched and given in one dose during the surgery if you are a suitable candidate. So again, if you're diagnosed early, your tumor is small, you can get your radiation therapy in 20 minutes during surgery, equivalent to the 5 weeks of radiation which you would have had to take otherwise as the traditional way of doing radiation. Pink October, pink awareness, breast awareness, it is a yearly event, but it should be a whole year event. You do not wait just to be reminded about your breast when people talk about it during the October month. What you need to do is you need to actually be aware. So there's so many of these NGOs out there, who do breast cancer awareness. The idea is to educate the public, to go out there to the public, to talk to them about the disease, to allay their fears, and to make them, more aware of this disease, and to make them understand and come forward to get themselves checked and come forward to get themselves screened. This is so important. So these are the people that are out there to help. So you cannot say that you don't know anything about the disease, that you're too frightened to come to the hospital. These are the places that you can go to for information, for education, for cancer patients, for caregivers. These are good places, avenues to get involved with, because you meet fellow cancer patients. The caregivers learn from other caregivers how to manage their own family members and things like that. There's a lot of sharing and giving and learning at this, breast cancer groups and breast cancer foundations and associations which are out there. So we talk very quickly about complementary treatment is fine. Complementary treatment just means taking a treatment alongside with your actual cancer treatment. So vitamins, herbal treatments, exercise, diet modification, acupuncture, it makes you feel better. If you need to see a psychologist, by all means see a psychologist. It helps you with your mental support. Religion is very important. If you're a religious person, this is where your religion comes in. It helps you to cope. It helps you to be able to go through your treatments well with all the support that you get. Alternative treatments, unfortunately, is not what we advocate. Going away from the conventional and alternative as a complete alternative is not acceptable. These are the traditional ways of doing it with your bomos, with your sinseis, the traditional healers. These, unfortunately, are only going to prolong your disease, delay your treatment, and you end up dying of the disease, unfortunately. And by the time you come for treatment, often it is too late, and the outcome is very poor. So my take-home message actually to everybody is listen to your body. When your body is telling you something is not right, it is telling you something is not right. Pay attention to it. Do something about it. Never have that apathetic attitude like, oh, if I just ignore it, it'll go away. It's not going to go away. It's only going to come back and bite you very hard. So listen to your body. Nourish your body. Eat well. Devote time for exercise. Make time for yourself. Women, you're busy women. We all know that. We're all career women. You cannot allow that to rule your life. There must be a time allocated for yourself, for your health. It's very, very important. And this is what women empowerment is all about. You need to empower yourself to take care of yourself and to, make sure that you are well looked after. Unless you are healthy, your whole family will collapse otherwise if you develop a problem. So you need to look after yourself. So nourish your body. Educate yourself with accurate information. Please do not listen to hearsay. Please do not go on to unfounded blogs, people who write, unfounded things on the internet that only scare people when they read things. Go on to good, credible websites, learn about the disease in a scientific manner, understand what it is, because if you do that, you will understand what it's all about, and you will make good choices for yourself, you will make good decisions for yourself, and you will have a good outcome. So, and if you can pass this message to your fellow, friends, sisters, mothers, relatives, then my job is done here. Thank you very much.
Thank you very much to Dr. Harjit for giving us that comprehensive talk, giving us the right perspective about breast cancer. Truly, we are now aware that with early detection and proper treatment, cancer is curable. So be breast aware. Once again, we would like to thank Dr. Harjit for benefiting us with her expertise and her positive approach. Thank you.